Bismillahirrahmanirrahim. Today's topic is ptosis, which refers to drooping of the upper eyelid, which may be unilateral or bilateral and partial or complete. So, ptosis is the result of dysfunction of one or both upper eyelid elevator muscles. There are two upper eyelid elevator muscles, that is levator palpebrae superioris and the molar muscle, including the lower and the upper molar muscle. Lower molar muscle elevates the lower eyelid and upper molar muscle elevates the upper eyelid, and levator palpebrae superioris elevation of the upper eyelid. So it happens that if these muscles are there is some dysfunction in these two muscles, like that is paralysis of this muscle will cause ptosis. The levator palpebrae superioris is a striated muscle which is innervated by the oculomotor nerve, and the molar muscle is a smooth muscle innervated by the sympathetic system. So here's the reason, there are many causes. There can be unilateral and bilateral ptosis. So unilateral ptosis can be caused by Horner's syndrome, third cranial nerve paralysis, and it can be congenital. So here is a flowchart in Davidson where it shows that neurological causes of unilateral ptosis. We'll study it a little bit later, and then so again there are some bilateral causes, that is other myopathies and myasthenia gravis mainly causes bilateral ptosis. But if we want to point out some differential diagnosis of bilateral ptosis, we can say myasthenia gravis, snake venom poisoning, bilateral third cranial nerve palsy, and ocular and oculopharyngeal myopathies. Mainly, if we want to memorize these things, mnemonic is the myopathies. Mainly, it can be myasthenia gravis, it can be snake venom poisoning where paralysis occurs, it can be ocular and oculopharyngeal myopathies. Bilateral ptosis can occur in these cases. And if we want to differentiate between myasthenia gravis and third cranial nerve palsy, if here bilateral third cranial nerve palsy can causes bilateral ptosis. So if we want to differentiate, here is that if there is myasthenia gravis, then there will be difficulty in speech, chewing, then swallowing and combing, and diplopia or double vision symptoms that will be worsen in the morning or in the end of the day, worsen in the end of the day or after exercise. Myasthenia gravis and third nerve cranial palsy can be differentiated by diplopia or double vision, restricted ocular movement, dilated and non-reacting pupil, and loss of accommodation reflex. So these are the bilateral ptosis, causes of bilateral ptosis. Now we shift to, here is picture of figure right-sided Horner's syndrome due to paravertebral metastasis at thoracic 1. There is ipsilateral partial ptosis and a small pupil. So here is a chart where it shows that, here is a chart, if there is unilateral, for the shivering, there is unilateral ptosis. If there is diplopia or some upgaze, then it can be third nerve palsy. So we should check for dilated pupil and other signs of third nerve palsy. So on upgaze, যদি হচ্ছে upgaze, it means উপরে তাকানো. Then if there is diplopia, then we should go for third nerve cranial nerve palsy. Then if there is unilateral ptosis with larger pupil, then in third nerve paralysis. If there is a smaller pupil and increasing accommodation, then Horner's syndrome. If there is diplopia, here is two causes. There is diplopia in two cases and normal pupil in both two cases. If there is fatigable weakness, then we should consider myasthenia gravis, fatigable weakness. And if there is normal pupil but myasthenia is excluded, that means no fatigable weakness or any signs of myasthenia gravis, then we should go for family history to consider mitochondrial disorders like CPEO, that is chronic progressive external ophthalmoplegia. CPEO, it is a mitochondrial disorder which full form is chronic progressive external ophthalmoplegia. So here so the treatment is treating the underlying causes, like we should treat the myasthenia gravis, we should treat the third cranial nerve palsy, we should treat the snake venom poisoning if there is, and go for antivenom. We can do also some investigations like brain CT scan or MRI, or brain CT scan or MRI, or chest X-ray and chest CT scan. And in case of snake venom poisoning, then we should go for anti-acetylcholinergic antibody. I'm not sure about that. So again, these are the investigations. And to treat, for treatment for treatment we can for treatment we go for, and for treating of the underlying causes, like all these causes that we studied further, now we should be Horner syndrome, we should be treat them. And if the ptosis is obstructing or disabling the vision, then we should go for surgical correction if needed. If needed. So that's all for today. Sorry for them. Sorry if there's any wrong or mistakes, any mistakes. Thanks for watching. 見てくれてありがとう。